It's never easy to change our lifestyle, even if you know it's going to make you better in the long run. But I know, and we all know, when the doctor tells you, after having had a physical, that the risks of not following your doctor's advice, the costs of doing nothing, are far greater. As the doctors with me today will tell you, America's had its checkup. It's been going on for a long time. It didn't happen quickly. All the tests have been run. And the prognosis is not very promising. Our healthcare system is not healthy.
We know that it's time for change. It's time for us to do some things which may be hard but are absolutely essential for the survival of good health care in America. These doctors have set out the blueprint for us to follow in terms of the work that we're about to do. Now, you've listened to the speeches that have been given on the other side of the aisle. I'm glad there are a handful of Republicans who are stepping forward to help us with this. I wish there were more. But more often than not, what we hear from the other side of the aisle is, let's not change anything.
We are too close to achieving health care reform to stop now. Achieving this will benefit all Americans. We have a rare opportunity to reshape health care in this country to provide primary care that prevents costly illness and coordinates care for different specialists and settings. Family physicians cannot understand why we would ever want to continue a healthcare system that reduces productivity, accelerates cost increases, and promotes inefficiency. Why would this status quo be acceptable to anyone?
My patients will experience irreparable harm if we leave it to a future Congress to pick up the pieces of our currently broken healthcare system. We can and should debate how best to achieve these goals, but debate must not be the excuse for delay. Change is never easy, but change we must.
The health care bill that we passed out of our HELP committee has a very strong workforce component because we want to make sure when we provide care that it is there for the American public. These are the things we are addressing in our bill, and it is why it is so important that we get this done.
We've got to remember that we have a goal to pass comprehensive health care reform that means secure and stable coverage that can't be taken away through life's ups and downs, lower and stable costs that won't eat away at the family paycheck and won't put health coverage out of reach, and better quality care so that you can get the treatment you need, when you need it, from the doctor you choose.
Our doctor's orders are very, very clear. If we don't start taking better care of our health care system, it's only going to get worse.
The American people want health care reform, and there are those who will put out the misinformation. But I believe when they get to see what we're doing and see the specifics of what we're planning, they're going to embrace health care reform. They're going to continue to embrace it and move us forward. So I think the more the American people know, the better we're going to do. We're going to get out our message in August as to what we are trying to do with specifics, and we will have dramatic change in health care signed into law by the President by the end of this year because the American people are demanding no less.